Okay, so good afternoon, everyone. Good afternoon. So we will be starting our course for today. Okay, so good afternoon, everyone. Good afternoon to all our active and hardworking nursing leaders. Good afternoon to our speakers, to our respective speakers, and of course, good afternoon to our nursing administration, led by our nursing director, Ma'am Rowaida Nahuli. So for these 3 days, we will be having our course for our active leaders entitled Effective Nursing Leadership and Management. So nursing education in strong support of our nursing administration has organized this course for our leaders in this institution, and we have some leaders from our primary healthcare. So for 3 days, we'll be having fun learning activities. So there will be combination of lectures, presentation, and of course, we'll be having some workshops and some games. Are we all excited? Yes, so we're excited for the activities that we'll be having for 3 days. So we are hoping from nursing education and of course from nursing administration that we'll be able to apply. Application is very important, right? Application is very important. So all the knowledge, the theories that we will be having from our experience and from our respective guests, our respective speakers. So we have to apply it into nursing practice so that we will be more improved, okay? And we will be a better leaders who will run our each department. Okay, so I'm Roy Francis Cordero. I'm one of the nursing education coordinator. To officially welcome us in this 3 day seminar, so may I call on our very active nursing director to give us a short welcome remarks. So let us all welcome Ma'am Rowaida Naholi for a short message.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everybody. We decided this year to do the leadership courses for 3 days, and each day it will be 2 hours to 3 hours. We plan it, and we, inshallah, you will like it. We select the topic very carefully, and we review all the courses to make sure that it is meet our goal that we need from our leader. Welcome to all of my leaders, and I hope you will enjoy the session. I want to thank Ms. Rina and the Education Department for the support and for organization. And we do it live with the Mudiria. Thank you, Dr. Amal, to offer this opportunity. And we let's share what's the course that, inshallah, it will make their part. Thank you for all participants that joining our hospital, and inshallah, will enjoy this training. Thank you.
Thank you, Ma'am Roida. So to start our session, so we'll be having the first a speaker. So let us all welcome our first speaker, Dr. Hawazin Rawas, Associate Professor in Nursing in College of King Abdulaziz University for Health Sciences, Jeddah. So she'll be giving us one of the most interesting topic, which is inspirational leader and how we will be more motivated at work. So let us all give her a big warm applause.
Hi. Thank you. Good afternoon, everyone. Thank you so much for the invitation. It's my pleasure to be here with you today and present one of my favorite topic, which is about the leadership or management. Um, as we all know, if you have a good leader, you have a good life. Because if you finish your job with a good leader, you will go to home and you will be happy. You will spend your weekend and you are happy. And the opposite is correct. If you don't have this good leader, the motivational leadership, you will be sad all the time. So I will start, I will not take long time, I will start my presentation, which is about the inspirational leader. And I would like to start with a question. So if you can discuss with your friend next to you about the leader, is the leader born as a leader or she can learn the skill for the leadership? What do you think? Both of them. Which one is most, like it's covering most of the skill? To be born as a leader or to be learning the leadership skill? Learning the leadership skill. So the leader, she can born or he can born as a leader, but this like make 20 to 30% only. The rest of the percent she can or he can learn how to be a leader. And just tell you story about myself. I came here in Saudi Arabia like when I finished my study in 2015. I start like before I was in the clinical area, nurse in the clinical area. After I completed my master and PhD, I start a new job for me. It's like teaching the student. I wasn't know how to teach the student for the first time. Like it's been maybe 6 months. I'm struggling to teach the student to deliver the information in the correct way. One of my leader, she's really inspired leader for me. She asked me to do another degree after the PhD, to do a medical education master. Everyone was like shocked. After you finish your PhD, you will go back and take another degree, like a master degree. Is it worth it to take this degree? I listened to her. I applied for the second degree, which is a master. At that time, I was teaching and studying in the same time. She said to me, you will learn how to teach the student, you will learn some of the leadership skills, you will learn how to evaluate your faculty. I didn't get this point at that time. After I start my Master of Medical Education, 2 months I think after I start my medical education, I received a promotion to be as Associate Dean of the Clinical Affairs in the college, which was, it was really shocked for me. Everyone was happy around me except myself because this is the first time for me to be a leader. I just came from like scholarship. I didn't get the pathway, the correct pathway of teaching the student. So I have three things to do. I have to teach the student. I have to complete the master, the medical education master. I have many of the employee under my name. I'm a leader now, and I'm in a position. So I was struggling at that time. The same leader asked me to do some of the workshop related to leadership outside the kingdom. I went to Finland. I spent, I think, 3 weeks to take one of the workshop or one of the course about the leadership. When I arrived there, I found everyone in the hall the same situation as myself. They are old and they are a leader for the first time. At that time, I know that the leadership it can be taught. You can learn the skill for the leadership. It's not necessary to born as a leader, but you can learn a skill to be a leader. So 3 weeks, it was 3 full days, 3 full weeks, sorry, to learn about to be a leader. So this is to be starting for us today. Leader, you can, every one of us here, you can be a leader if you have skill or you learn how to be a leader in the future. So this is the objective for today. Another thing I want to talk about it today, manager and leader. So if you can talk with the one who is next to you, what is the characteristic of the leader that you think it's a characteristic of the leader at work, and what is the characteristic of the manager? Just discuss that for 2 minutes. Do you think there is a difference between the leader and manager?
Yes.
What is the characteristic of the leader, of the good leader, and what is the characteristic of the good manager? Do we need both of them?
Yes.
Okay, we need both of them. Why? What is the characteristic of the leader that we need it in our field? Any answer? What is the characteristic of the leader that we need it in the job, and what is the characteristic of the good manager? Okay, we'll discuss it later on the end of the session, because we have some of the worksheet you have to fill it. The manager, all the time, word manager, it's connected with the control. Manager, control. The leader, lead. This is just to remember. Manager, she or he control the one who's under her, and the leader lead the rest of the team. Both of them, it's important to any organization. The leader cannot work anything without the manager, and the manager, she cannot do anything if there is no leader in the board. So both of them must go hand in hand. Both of them necessary, and they complete each other, the leader and the manager, and we cannot separate any one of them. Okay, what is the job or the most important job for the leader? The leader, it's motivate. The leader inspire other all the time. I remember, I think, Miss Inas, she know him, Dr. Muhammad Halawan, Allah يذكره بالخير. Our head in the infection control in King Fahad University, this in 2006. He's my boss, but he's the one who gave me the advertisement for the new job. He told me one day, he came in the morning, he told me, Hawazin, I found there's a job in one of the university here in Saudi Arabia. Why he didn't apply for it? He's my boss, and he was here happy with me. But he motivated me, inspired me. He found another job for me, and he said, it suits you. Why you didn't apply for this job? So on that time, I applied for that to be clinical teaching, and then after that, I went for a scholarship, complete my study, and now I'm working in university. So all the time, the leader, you will find your leader to motivate you all the time, inspire you, and the manager, it's control, it's organized, it's a coordinate. Manager, it's very important for the manager to look at the details. The leader, she's looking for the overview of the work. But the manager, it's plan, all the plan, it's come from the manager. All the organizations, it's come from the managers. All the coordination in the work, it's come from the manager. So the leader in the hospital, for example, will give you the instructions. I need by the end of this month or this week, you achieve this point and this point and this point. Who will work on this point? The manager. She will organize how we can achieve this point, and she will plan to achieve the other points, and she will coordinate the work between the team or between the staff in the world to achieve this goal. So what's the difference between both of them? The leader, it's all the time looking at the original and innovate. Any new idea, it's come from the leader. So if you are a good leader, all the time think about the new idea. How I'm gonna improve the hospital, for example. There is any new idea for that. While the manager all the time it's copying. Yes, this is the idea. It was a successful idea from last year, so I will continue on this idea. I will not create any new idea because I don't want to be struggle. I don't want to challenge my staff. I will continue this idea. Is this wrong? No, it's right. This is the job of the manager in the world or in the hospital or anywhere. This is the role of the manager to continue exactly the same way, the previous way, to copy the word. Yes, the surgical word, for example, they are doing this and this and this. Why we are not doing the same? Because it's a successful point. So we will do the same. It's important for her to look at the details. She will copy the same way as the other word and she will continue. The leader, no, she liked or he liked to have a new idea all the time and give the new idea to the manager. Ask all the time. You will find the good leader to ask what and why. Why we are doing this one? What we are looking for by the end of this year in the quality part? What we are looking for? Why we are doing this? While the manager all the time, how I'm gonna achieve the quality of my department, when I'm gonna find the result of my department. So all the time you will find the manager looking at the small part, looking at the detail in your department. When and how we gonna find the result. The leader, she will give what is the result of the quality, for example. What is the result? What is the achievement for your staff? The status of the leader and manager, as I said before, challenge. The leader, one of the characteristics of the good leader, inspired leader, challenge. So if your leader gives you something difficult, she knows or he knows that you will solve the problem because she challenge you and she know how you're able to solve this problem. It's challenge all the time. But the manager it's accept the same situation. She or he doesn't like to change anything. Accept the department as it is, but try to improve it. The leader all the time looking for the long term, while the manager is the short term. As I said, by the end of this year, we need to achieve the high grade for the quality, for example. But the manager, no, short term. By the end of today, inshallah, we will not have this issue in the department. So she's looking or he looking at the short term, today, tomorrow, day by day. The leader, by the end of this year, and take your time, by the end of this year, we need to get the quality approval or the quality achievement for our department. All the time, the inspired leader, you will find her or he as own person. In the work, outside the work, as a friend, it's a leader. Her personality, this is the personality, working with her heart, give you the instructions in a good way. The manager, classic good soldier. Really, the manager is a good soldier. I have a group of friends and usually we travel together. One of them, she's a manager for two other two friends. Even during the travel, she's working as a soldier. We need to go this place and this place and this place. And we will take the dinner at this time and this time and this time. When I asked the other two why she's talking to us like this, they said, no, she has experience as a leader from 15 years, so this is her way even outside the work. I said, no, but she's not a leader. She's a manager. She wants to control. She's a soldier. She's a soldier. She's my friend, but she's a soldier even outside the world. When she talk to you, يعني very strange, control, she want to control everything. she's right all the time. She wants all of us to listen to her and to do what she wants. So she's the manager. It's not wrong, but she has a characteristic of the manager. It's not a leader. Because the leader, she keep her personality all the time in the work, outside the work. The leader all the time develop change. We need to change in our hospital. We need to go from this step to this step. I need to change. Yes, we are good. We are in a good stage of developing the quality in the hospital, but we need to move to the next step. The manager, she doesn't like to change at all. We are good. We are keeping the same strategy. We need to stay on the same strategy because it's a good strategy and they are successful. But she wants to stay in the same way, to treating the staff under her, for scheduling the staff, for the vacation for the staff. She wants to keep the same over and over the years. The leader, no. Yes, we are successful, but we need to move on. We need to move to the next step and find another way. Maybe she's good, or the way it will be good, we will be successful again. Maybe no, it's a challenge. So the leader seeking all the time the vision, it's long term, while the manager is again objective, day by day. The leader it's about effectiveness and the manager efficacy. I need, for example, by the end of this month, everything it will be effective and only give the order. But the manager it's efficacy, exactly what happened during these days to be successful. The leader all the time, inspire leader all the time, set direction, set a new direction, especially new direction, while the manager plan the details. Okay, this month we need to do this with our patients. Next month we will try this way with the patients. So it's a detail. Goes to the exist roads, as I said, it's not trying any new things. The system for the leader all the time working on the system. The leader in the hospital for the nursing, for example, working on the King Abdullah system as a general for the hospital, while the manager are working the system. مين اللي بيشغل السيستم في الهوسبيتال؟ المانجر. Leader just give instructions, she leave الميتنج. مين اللي بيشتغل على الديتيلز وبيديلك exactly البلان؟ المانجر. That's why both of them, leader and manager, it's very important. A leader give the instruction, give the overview, give the vision for us, and the manager will apply these visions on the details. Small things will be applied by the manager. Decision all the time, a leader facilitated decision. Okay, we were in a meeting and everyone has a new idea. The leader will listen to every one of us and facilitate a decision. Okay, if your decision like this, what we gonna help us to take this decision? While the manager take a decision, it will not give you a chance to give your opinion on this decision. So the decision by the manager, taken by the manager, while the leader facilitate, listen to every one of us and discuss which one the best solution for us or best decision. Then after that, take a step and yes, this is the decision that we will take it from this meeting. All the time, the leader is working with her heart. So it's not bad things to work with your heart. That means you have some of the leadership skill because the leader all the time working with their heart. That's why we need also both of them. Because if the leader working with her heart all the time, the work it will not go. The manager working with her head. But also if the manager alone and working all the time without heart, the work it will not work. So both of them it's needed for any successful work. The leader all the time use the power for knowledge about the future, while the manager is formal authority. صفة من صفات المانجر اللي ممكن تتخيل كل المانجر اللي بيشتغلوا معاكم فيهم هذه الصفة إنهم formal authority. حب إنه كده تديهم وضعهم. تقولي لها انت بتسوي ده الشيء، واصلا انت لو رحتي ما حنشتغل، وانت يعني they like a formal authority. وهذه يعني واحده من السكيل اللي هي عندهم. ممكن ما هم born with this skill، ممكن they learn this skill. انه انا manager، أنا المانجر of this department. Everyone they must listen to my instructions. They must give me the authority to do anything, and I have already the authority to do everything by myself. I'm not waiting for any decision from anyone. I'm not waiting for any opinion from anyone. So this is the manager. The leader, exactly the opposite. It's like a friend of you, sometimes talking to you in the corridor, talking to you outside in the home, calling you through the phone. So it's the opposite exactly. A leader passions all the time. Passions. أنا شفت إنه هذه الإنسانة عندها ability إنها تكون في another department. I will move her to another, transfer her to other department, because I know that she has the ability to do better in the other department. But the manager, no, I'm controlling everything under my control. I will not move. This good in this department, she will stay. What is the benefit for me if I move her in the other department and she prove herself in the other department? What is the benefit for me? So this is the thinking of the manager all the time. While the leader, no, she has a passions, inspire, she's moving you. As I told you before, my story, my boss, my leader, he asked me to move to other job because he find that the other job maybe it's better than the job that I was working with him in the same job. Dynamic all the time. The leader prevent the problem from the beginning. She has a vision. She know that if we do these things, we will struggle or we will be in trouble. So she's proactive. While the manager, if you are in a problem, she will solve this problem. She cannot prevent the problem by her skill, but if you are in a problem, she can solve this problem. Accomplishment. The leader it's accomplished the achievement. This is the goal. Even the goal it's not for the department. The goal is to prove that I have a good staff. For example, the leader of the hospital, she thinks that all the staff in the hospital, they are very good. And when you have the accreditation, one of the comments that, yes, you have a good staff in this hospital. This is her goal. This is achievement for the leader. Her staff, it's good. But the manager, what did in this hospital? What you are doing in this hospital, this is my achievement. What is the result? The details, the result. We don't have the risk for infection, or we don't have that much of the infection in the hospital. This is my goal. While the leader, maybe she has another way of thinking about the goal of her staff. The style transformations, the leader, while she's working with her heart, also she wants everyone to transfer, or she wants the organization to transfer from this point to better place. While the manager, she wants to keep the same and working on the detailed things. The leader, excitement for the work, happy, we achieve what we want to achieve this year, I'm very happy. The manager, some money for work. I think all of us will have this point. It's a money. I'm working here because the end of the month I will get a good salary. The leader thinking about another thing. What the leader want the achievement, and the manager want the result, as I said before. And taking the risk, it's always by the leader, and minimize the risk always by the manager. You will find the leader breaking the rule all the day. Breaking the rule. You cannot take a leave during, for example, for us as a university, we cannot take a leave during the academic year. A good leader, Yes, you have some situation, special situation. I will give you. I will break the rule. I will give you this one. I will find someone who will cover you in your work. The manager, no. You cannot. This is the bylaw of the university. As academic, you cannot take any leave during the academic calendar. This is the manager, and it's a right because she's a manager. But we have a head of department, exactly managers. Each time you go to her with any situation, no, the bylaws said this and this and this. So sometime we need, after we talk to her, just to follow the chain of command, we go to the dean. We have this situation and this situation, you will find the dean breaking the rule. Yes, you have a special situation. Okay, you can take the lead. We need both of them. Sometime, some of the faculty, they don't have any situation, but they want to leave. So the manager, they will stop. The manager, she stopped them. No, this is the bylaws, you cannot take it. The conflict, use a conflict. The leader use a conflict. I have a conflict as a leader with someone. I will use this conflict to improve something else, to improve my personality, for example. But the manager avoid the conflict. She doesn't want to be involved in any conflict. A leader seeking the truth, but the manager established the truth between her team. And the leader all the time, what is the right to do this one? What is the right to achieve the accreditation for the hospital? While the manager taking the good and right step to achieve the accreditation. For example, in her department, she will follow all the criteria to achieve the accreditations point or accreditation certificate for her department. The leader all the time taking the blame. Yes, we are as a department, we did a mistake. This is the word that all the time you will hear it from the leader. Yes, this is our mistake because we didn't follow the instructions. Sorry, this is the mistake that happened from my department. The manager, this one did a mistake. Give you a name exactly in any situation. Give you the name. I have one staff who is not working very good in my department and I need to punish her or punish him. Give you exactly the name. This is the manager. Blaming other. Even if she's the one who did a mistake, she will put the blame on the other one. The leader all the time, it's where the work is going outside the organization. This is her thinking, where I want to put my organization. And the manager need to done inside the organization. She will not think anything about the outside, only her thinking is in the organization. The leader explore the thing, I need to know what exactly happened here. The manager, the details. Give me the step of this problem. The patient got infection, how it's got the infection exactly. The leader know what is the number of the patient who had the infection or eating problems. The leader all the time working with the other as a follower, but the manager is looking for her staff as subordinate or the employees under her. Taking the ownership and the manager all the time, they are responsible and they are a good in taking the responsibility. The leader just give the instructions and leave it for the manager. The manager, she has the responsibility to do all the detail work. And for the change, if the leader is creating a change and the manager, if there is any change in the hospital, I will react, I will follow the change that you needed. And the leader all the time selling and pursue the manager, communicate with the staff and giving them the instructions, telling them what they are doing exactly. And leader creating a team, manager direct a group. All the time she's direct the group. The leader making hero for everyone in the department, while the manager trying to be a hero. I'm the hero and I want to work this way. The leader giving credit and manager taking credit, and the leader looking for the future and focus on the one who's working with, while the manager working on the system and structure, don't think about any one of her employees. The leader developing the power with the people, while the manager exercise the power on over the people. So do we need both of them, or the hospital or any organization need both of them? Yes, because the leadership begin when the management is finished, and the management is begin when the leader give her the instruction. No one can start from without the other one. So this is the conclusion for today. We need both of them to be in the organization. And one of the best book that I read it about the leadership, if you want to get it, this book, Good to Great. This book, it's about research, someone who did the research with a group of the research, how we can move the good company to be a great company. And they are talking about the leader in this company. What is the characteristic of the leader in this company so they move from good company to great company? And what is the characteristic of the other company who stay as a good company? They are not moving to the great. And one point, I read it yesterday, it shook me actually about the leader. All the time we think about the leader who has a wasta. She knows someone and she's very active and she's very socialized with the other. She wants to talk here and here. She go to the meeting, she go to everywhere. This group of people, they found that the company that moved from the good to great company, all the leader. All the leader in this company, they are very quiet, they are very shy, they don't like to talk about themselves at all the time talking about their team. And this is research. They did a research about this one. And during the interview, they found this result. All the leaders, they are very shy, they are not socialized and talking to the researcher as a team. They are not talking to the researcher as we are the leader. They are talking, the team in the company did this and this and this. So that's why we are moving from, and even the benefit for the money, they are moving from good to great company. While all the leader who's stay to be a good, they are a good company, but they are very socialized and very active and they want to يعني, all the time, I'm a leader doing this with my team, I'm giving them these instructions, this is the way that I give them the strategy to follow. So this book is one of the best book talking about how to be a good leader, to move your organization or to move yourself from good to great. I have here some more sheets. Okay. So it's enough. Let's just I give you some highlight just to put it as, is this a leader characteristic or a manager characteristic? It will take 2 minutes. After that we can solve it together. هذه أول واحدة. Okay, about the point that you have here, the sheet, I put some of the leadership characteristic and some of the manager characteristic. If you are avoiding the conflict, do you have the characteristic of the manager or the leader? Manager, and breaking the rules. Leader, all the time breaking the rules. Concerning about what is right. Leader. And developing power with the people. Establish the truth. Seeking the truth. Leader. Establishing the truth. Manager. Implement a good idea. Manager. Lifestyle action. Manager or leader? Action. Leader. She likes to do action in the department, but the manager, she likes to have the same stable situation all the time. Originating a new route and directions. Leader. Taking the blame. Blaming other. Taking the credit. Giving the credit to the other, the leader.
Yes, ma'am. Thank you, Dr. Hawasan. So, it's our honor and privilege to have Dr. Hawasan as our guest speaker. Thank you so much, ma'am. So, really, thank you for providing us a very informative and interesting presentation. So, most of the audience here are leaders and managers. So, we just need three leaders or three managers to give us a situation or scenario wherein you can be more of a leader or more of a manager. So can someone share their experiences? Okay, so at least three managers or three leaders wherein you can be more of a leader or more of a manager. So can someone give a scenario or situation? You can apply more the leadership skills or you can apply more the managerial skills. So anyone? From our experiences, from our head nurses, from our managers, any volunteer? So after knowing the difference between the leadership skills and managerial skills, so do you have any scenarios that happened before wherein you acted out more of a manager or more of a leader? So any from our Camp CJ leaders? From the inpatient, anyone? Critical care? Yes, Ma'am Nadia, you have? Any experience? So this is sharing, interactive, so that we will all learn. Yes, during disaster. Someone which then has very good example here.
During disaster, the head nurse or the child in the ER, for example, she will act as a manager to direct and to make sure everyone on their place, and she will give the team, she will distribute, She will direct the patients, or she will just direct, she will not discuss.
She will be step by her staff. While the leader, she will come by the end of the day, she will say, what happened exactly? That's what she's looking for. She's a leader, she wants to know overview of the picture. What is happening exactly? Like in the same situation, if you have a staff, you are in the ER and you have a disaster, one of the staff come to you, asks to leave early in the same day. The manager, what is her reaction or what is her answer?
The manager, it's what I mean. The manager is a characteristic. It's not a person.
Yeah, I know the characteristic.
Yeah.
As a manager, characteristic as a manager, and you have a disaster in your department, and one of the staff, she come to you, said, "Can I leave early today?"
So can't be, because we need to manage the area, and there is a work should be done.
Like the same staff come to me as a leader in the hospital, and she said, "I have special situation. I have a sick baby at home. Can I go home?"
Yes.
As a leader, I will say yes, because I'm not living in the same situation as they are. And but I will find the solution. I will not breaking the rule like this just to make the other one suffer. No. Okay. Do you know anyone of your team who's working in the night, for example, to replace you? Okay, we can call her now. I'm as a leader. I will call the other one. I will make an arrangement for her and I will send her back to the manager. Said, yes, go to your manager and tell her that we have a solution and someone will cover me. I will go early today. This is what I mean by breaking the rule. Do you understand me? This rule? This is the mean of breaking the rule. In the situation, sometimes you will be in a situation in the hospital, sometimes you will find yourself in a situation you cannot say yes to your staff. And this right. You cannot say yes. Now I give you example. We are as academic staff, we cannot take a leave during the year. When I come to the head of department, she knows what exactly if this faculty absent for the class. She knows that we need time for the student to arrange with the student, and the student they are busy with the other courses. We need, for example, a time for the lab or for the clinical day for this faculty, and we need many of the arrangement before I give her yes, you can leave. So I will follow the bylaws. This is the bylaws for me. No, as a faculty, you cannot take your leave right now. You can take it in the long weekend or you can take it between the semester. When I go to the dean, for example, as my leader, it's just imagine the situation. I will tell her that I have, for example, a necessary situation with my children. I need to go with them for the other city, for example. And I already arranged with my team in the same course. They will cover me. They will cover me in the lecture. They will cover me in the lab. They will cover my clinical day. Said, okay, this is my approval. I signed your leave. Go back to the manager and tell her about the plan B for you. Okay. This is the last point. Clear about the breaking rule because I don't want anyone to understand this one wrong. Okay, thank you so much for your time.
Thank you so much. Thank you, Ma'am Wijdan. Thank you, Dr. Hawazen. Okay, so as what mentioned by Ma'am Wijdan earlier, so we are exposed with some disasters. So as nursing leaders, we are facing some challenges and uncertainties. So as leaders, how we will be managing, how we will lead during this time. So for the second session, we'll be having Dr. Hana Al-Jihani, Director of Change Management, to give us presentation about leading during uncertainty and vulnerability.
السلام عليكم ورحمة الله وبركاته. مساء الخير. Good afternoon, everybody. Today, our next topic is strategy for living through uncertainty. I'm Dr. Hana Al-Jihani. I'm consultant family physician, certified Arab board and Saudi board family medicine. Also CIC certified because I like the uncertainty and the change. And also CHQ certified. Recently, I certified with change management professional. First of all, I would like to thank the organizing committee, Mam Ruwaida, first, Ms. Nisreen and Ustadha Jawahir, يعطيهم العافية, and special thank you because you are giving me your valuable time. Today's journey will start with brief introduction, definition, then we will go to different types of uncertainty. We will learn how together we can deal with uncertainty by knowing different strategy. Then we will make a wrap up and game. Are you ready to start? Yes. I cannot start with this low voice. Are you ready to start? Yes. Third time. Are you ready to start? Yes. Sure? Okay. What should you do if you will receive this? Do you know who is this beautiful lady? Sure? Did you know? She's Mam Ruwaida. You will receive a message from Mam Ruwaida saying this. I will let you to hear what she said.
Estimados, buenas tardes. Disfruta de la presentación.
Once again.
Estimados, buenas tardes. Disfruta de la presentación.
Okay. Did you hear what she said? Yes. Okay, now you have to act based on her message. What you will do? Just write your feeling first, then give me 3 steps. What you will do to listen or to react with Mam Ruwaida message. Just write it down. Your feeling first, and then 3 steps you will do it to do what is written in her message. What you will do? Yes, the first you're feeling, but the 3 steps, what you will do, you have to do what she said. She said clearly her message. Yeah, you're feeling confused, surprised. Maybe she changed her language. Maybe she's not Mam Ruwaida. طيب, other feelings. Stress. She said stress. Okay, give me 3 steps, you will do it. Ask her to read the message.
Go to her office. Go to her office.
She's busy. She cannot, right now, she cannot
Call or text
answer.
what she wants.
Okay. Translate. Other steps.
I'll send the message, her message for her again.
You send her message with a question mark. With a big question mark. Wrong send. It could be, yes. Okay. Leading through uncertainty. It's a significant aspect of leader's job. We are dealing every day, sometimes every 1 hour per hour day, we are dealing with uncertainty. Sometimes circumstances and challenges can push even the most seasoned leaders to limit their capabilities. Life is challenging. To successfully lead others, we should lead ourselves first. Granted that each leader faces unique complexities. Maybe in the inpatients leaders, they are facing different uncertainty than OBD. Primary healthcare, they are facing different uncertainty than hospital leaders. We will know together the different strategy to deal with that and can accelerate our ability to learn, evolve, and negative complex circumstances. Please remember, what I will give you, it's a simple strategy. It's only information and knowledge. But if you want to get the maximum benefit, you have to memorize it, write it, then at least daily apply one of the strategies. Now we'll start with the definitions. What is the meaning of uncertainty? If you are not sure, what is the meaning? Uncertainty. You are uncertain. The way is unclear for me. Other definitions? Excellent. I don't know what I have to do, which pathway I have to go. So definition is a state of doubt about the future, what I should do, or about what is the right things to do. Especially we are leaders, we should inform others what to do. Vulnerability, definition, what is the difference between vulnerability and uncertainty? We're at risk to be harmed, either physically or emotionally. And I think once we are working in healthcare institute, dealing with patients, we are at risk to be emotionally or physically harmed. So it's the quality or state of being exposed to the possibility of being attacked or harmed, either physically or emotionally. So how does uncertainty affect leadership? Is it important to know how we can deal with such circumstances or situations? Why? Because we have team. We need to give them the instructions. If we don't know what we have to do, so how we can direct others? Uncertainty can also lead us to reward the wrong things. Sometimes leaders may reward good outcomes rather than good decisions and punish bad outcomes rather than bad decisions. So in uncertainty, we should look for the decisions, not the outcome, because we don't know the situations. So we are mainly aimed to take the good decisions. Many managers fail to distinguish between good and bad decisions because they are focused on outcomes. In uncertainty, we don't know most of the times what is the outcome, but we should take the good decisions. Most important, leaders' job to help people sense of the changing conditions, anticipate the likely scenarios ahead, and make up their own mind about how best deal with these situations. As Dr. Hawazin said, leaders can inspire, motivate the teamwork, even in the uncertainty situation. Now we'll talk about or shift our journey to talk about the three different types of uncertainty. The first one is probability, the second one is ambiguity, and the third one, and the most difficult one, is complexity. What is the meaning of probability? Chance. Give me an example from your daily life. One example.
There will be a lot of AR patient or there will be less AR patient today.
Okay, this is one thing. Another important thing. Do we work with the full staff today or I have an absent rate today? And this is, I think, the most important
Supply, come on.
issue in the first 1 hour, supply. So probability, the first type of uncertainty, it is related to those situations in which it's not possible to weigh the level of the risk or situations to take a clear decision. And generally it is due to the fact that many variables at work at the same times. It is impossible to predict consequences and outcome because we don't know the possibility. As we say, if we are dealing with patient with serious complication or serious disease, sometimes we know some of the information about the diagnosis, the treating physicians, the medication the patient is on, but we don't know what is the reaction of that patient to the same medication or procedures. Then we will go to the second type of uncertainty, which is ambiguity. What is the meaning of ambiguity? Unclear or maybe confused. Still, I don't have the full pictures, no enough information, so I cannot decide or take an action. It corresponds to those cases which there are doubts about development of effect of some situation or decisions due to lack of some of the important information. Typical situation in this case could be the use of experimental drugs. We don't know clearly the effect because we don't have enough study or information about that drug. No certainty about its effectiveness, nor its fully corroborated information about its possible side effect. Ambiguity, in this type of uncertainty, you must investigate and gather as much as you can from the information to see the most important picture so you can take the decision. As we say, ambiguity, it's also important to calculate the risk. What if I will do this decisions with this information and what is the benefit? Then we will decide and take an action. Then we will come to the third type of uncertainty, which is the most difficult to deal with. There is a problem that is difficult to understand in these cases because it's a new or uncommon situation and there is not much experience with it. Give me a clear examples. Still new, we are facing with a new thing. We don't know the full information about that disease or situation. Corona, monkey pox. This is all situations still new over the world. We don't have enough information about that organism or that disease or that virus. So the whole world affected during that time. It leads to the most intense sense of uncertainty. One clear examples of complexity, if we have our computer shut down. We don't know, it is from the cable or it is from the plug or from the computer itself or from the screen. We have multiple factors that can affect us. So we are dealing with the most difficult type of uncertainty. As we say, complexity is a clear example of it is COVID-19. And I think the leader who lived after COVID-19 virus and still they are leaders now, that means they are an excellent leaders. Yes, good. All types of uncertainty provoke some degree of concern because humans like to play it safe. No one of us can explore or put him or herself or her team in situations that are unclear. So it's a normal feeling. Only intelligent approach is to accept the inevitability of uncertainty and to learn to deal with it. Do we have another choice, another option? We can prevent it? We cannot deal with it? No, we have to accept and to face it. We finished from the definitions, different type of uncertainty. Now we are going to different strategies can be used to deal with uncertainty. As I said before, it's only information. I will give it to you. To take the maximum benefit, you should write it down and practice at least one strategy per day. The first and the most important strategy, please don't be panicked. Otherwise, you and your team will be in a big trouble, in a disaster. Try to calm down, take a deep breath, then start to act. It's critical to quickly identify something that will aid the organization's success and swing into action pragmatically. So we need to just relax, absorb the shock quickly because we don't have time, then try to put your outlines. And try to find something good. I know sometimes it will be all dark, but you will find some bright area you can start from it. Be careful not to overact, but get them to top shape and don't beat the best possible war. Have the grit to step into an unknown with confidence. Build your up capacity to withstand failure, recover, try again, and encourage others to do the same. First, relax, absorb the shock quickly, support your team, motivate your team, then act. The second strategy is embrace the discomfort of not knowing. We are human. We will not know everything in this life. So we should accept and change our mindset from that. As a leader, we have to know everything. No, as a leaders, we shouldn't know everything in this life. But unfortunately, during our career, we put in our mind that we are the best. We have to know the correct answer for each question in this life, which is not true, and this is not the ideal. We should change our mindset. We have to accept that is some area we don't know clearly about it. Accept the error that come in your eyes after you knowing the shock. So this is normal. You will not die. You will live until the end, inshallah. Accept that. Even if you see it in your team eyes, accept, relax, give them good support they need. This is especially true for high achievers. I know most of the leaders, they are the best people in the situation or in the organizations. They best marks and the best achiever. I know this is what we used to do in the past, but now we can accept failure. We can deal with uncertainty and unknown things and try to give us opportunity to learn new things in our life. Also avoiding these unpleasant feelings. I know the feeling is very irritating. We are dealing with how it will not be my attitude. Always I have to know exactly what is the best answer. This is not life, especially for the leaders, especially those who are working in healthcare settings. Put in your mind that we have to be learn it all, not know it all. So please, this is put it in your mind. And this shift need to be shifted in your mindset. You have to say that for yourself every day when you are dealing with uncertainty. And on step, you have to put, this is a new opportunity for me to learn new things. As we say, first, we have to calm down, not anxious, try to act, embrace the feeling of unknown, then accept the change and welcome the change and disruptions. Uncertainty launches us out of comfort zone because we are used to do the same thing every day with the same people at the same time. So this is give us unpleasant feeling and take us from the comfort zone. And put in yourself or in front of you that it's a new challenges, it's a new opportunity to learn new things. Focused leaders who can see the big pictures. And unfamiliar situations are often very strategic during such times. And there is one of the strategy also that can help us to see the picture from better view, which is zooming out. We will speak about it in the next few slides. And put in your minds that every setback convey a lesson and act as a stepping stone for an only intelligent leaders. But weak leaders, they will take a step back. With every disruption, an opportunity presents itself. Try not to play defense at such periods. One of the most important steps mentioned by Dr. Hawazin in the leaders part is to be proactive. Just imagine every day, what could I face during this day or during this week or during this month, and try to prepare yourself and your team for it. Another strategy, and very important, don't go it alone. Please try to share it with your team, even your feelings. Sometimes you have to express it and do ventilations with your team. Many leaders feeling isolated as they face the continuous changes and uncertainty in the challenges they face. Still, we are leaders, but still we are human. Part of their sense of isolations come from the implicit belief that they need to solve all the problems by themselves alone, which is completely wrong. As the complexity and volume of our workload increase, our natural tendency to double down our focused individual's effort. When we are facing relatively short-term challenges, that it could be a good opportunity or a good reason to face it alone. But when we are dealing with a long-term period of uncertainty, we have to share it with our team. There is inherent limit for each of us regarding what we can know and what we can do and our ability. Don't overwhelm yourself as a leader. Share your situations to others. And working with a good team, we can expand our knowledge and our perspective. Other strategy, transparency. Once you are calmed down and try to act with the uncertainty, build up your team. And to have a good team, you have to be transparent with them. Give them clear information. Transparency engineers confidence. If you are not open to your team, then they will simply imagine the worst. And you will give the chance for the rumors to start and giving some wrong information. At that time, you will have a lot of misinterpretations and miscommunications, and you will increase the size of the problem. You have to be transparent with your team and give them only the specific information, not only the full pictures, only the specific information that help them to act and to react carefully with that situation. Build trust and connection. It's very important to build the trust and connection with your team. Trust is usually broken when people resist change. So we should accept or discuss the situations with all, each team members, if they are accept the idea or they are resistant to the idea. There is tendency to doubt anyone with contrasting opinion, leading to disconnection and disorganizing the team. Because if you are facing people, they are resistant to your idea or your vision or goals, that means that you are broken your team. Uncover ways to help people feel safe to share their experiences. Active listening to your team, their ideas, their concerns, their expectations. You have to discuss it and actively listen to each team member in your department. And even if you have the conflict with others, you have to solve it and know the different opinion, different from your opinion. Be observant enough to notice where people disconnect and give them space and enough time to do so when they are fully overwhelmed. Resist perfectionism. I think one of the most difficult strategy for me, this one, resist the perfectionism. Because as a leaders, we are always looking for the best, always we are looking for the optimum. But during uncertainty and disaster time, we should accept the wisdom way of thinking, not the type of perfection. We should look for our strength, what we can do with our strength and the weakness, and try to find solutions for us in these situations. One of the other strategies can be used in uncertainty: focus on your goals. What we are doing for the organization or the department, and try to focus on our values, because it will help us to know the right directions. Significant part of leader's job is to motivate teams and offering guidance. Uncertain situations make decisions making difficult for everyone and complex to deal with conflicting informations and opinion. In team setting, leading through uncertainty involves strategically aligning what matter and those within your control. It's critical to know the team's status before you can help them to cope and adjust with uncertainty. Your guidance as a leader is very important and can be a significant signal in supporting your team through that time. Zooming out. What is the meaning of zooming out? Can I have one volunteer, please? From the back side. One volunteer. Volunteer, volunteer, volunteer. volunteer. أنا حب اليمين اللي في الأخير. تفضل. فولنتير فولنتير تفضلي. خليكي في مكانك. تقولي لي بالضبط ايش الاشياء اللي شايفتها حواليكي. What you will see from your setting. Yes. Screen. People. Chairs. Pathway. Wall. Light. ممكن تشرفينا هنا لو سمحتي. اوصفي هنا ايش شايفه. Just describe what you will see. Like entrance, pathway, chair, people. ايش ثاني كمان؟ camera, laptop. So you want to focus with the engineer. Engineer. Wood. طيب your vision كانت افضل وانت جالسه مكانك هناك ولا هنا؟ بالناس؟ ايوه. Okay, this is what we meant by zooming out. Sometimes, sometimes we are facing problems, we will focus on only small part of the problems. Leaders, they need to do zooming out, to see the full pictures, to see what is the challenges, what is the opportunity, what is the main problems, either internally or externally. Sometimes we need to focus on different topic or different subject if we have specific problems. But leaders, they have to do zooming out to see the full pictures. I hope it's clear. Do you you know how percent of the iceberg we can see? 20 only percent from the problem or from the challenges. But if we did zooming out, we will see the full picture. So we can deal with it in a proper way and take a good decision. This more holistic perspective allows for greater adaptability and course correction when needed. Making regular practice of conducting zoom in and zoom out. It depends on the situations. If it is clear for me, I will do zoom out to see the full pictures. If I have a problem in specific department or specific KPI or specific patient, I will go deeply and see what is the problems in details. Adopting zooming out strategy can improve our ability to continually learn, grow, and more effectively navigate increasing complexity of our work. When we do that, we will go to another strategy, stay open to possibility and opportunity. If we have the full pictures, we can see sometimes in very difficult situations and uncertainty, we can see bright light, so we can go in that direction. Leaders and organizations will tend to embrace change as an opportunity to design a new vision and strategy. They look forward to enhanced process, seeking new market, pinpointing areas. Sometimes we are inspiring our team new ideas, new process, even new rules and regulations we can implement it if we stay open to all possibilities. Such leaders and companies will often surpass and tend, as you said, Doctora, it's from good to great company or good organizations. Another strategy is very important is sharing experience with others. Take others' opinion. If you are head nurse in OBD, share your experience with or ask the expertise in different even facility, different hospital, what you will do regarding this problem, what you did before during that problems, and share experience with your team locally or with expert in your facility or situations, and you can go even internationally, ask people what they did before to pass that. Leaders will find the need for reservoir for positive experience to pull inspiration from critical in time of need. Even without personally having such positive experience, they can always benefit from stories of others. Seek to understand experiences of others, including respected supervisors, elders, leadership development professionals, teachers, and others, and Mamroida, of course. Consulting peer and team members should always be an option in addition to nationally and globally recognized thought leaders. We finished from definitions, different types of uncertainty, different strategy, again and again and again. If you want to master the different types of strategy, you need to memorize it and practice each strategy at least one per day. At the end of 3 months, you will be an expert leader. Just to wrap up what I say, uncertainty can cause anxiety. I know it's unpleasant situations. We hope we will not face it, but this is life. We cannot prevent it. Polarizations, disconnection. Leaders and teams can evade this through collaborations and striving to understand and sustain each other. At the best, uncertainty creates an opportunity to improve the situation, encourage deeper connection and understandings. When people are heard, understood, and valued, their commitment to the team and cause increase. During the COVID-19, I worked as the occupational health manager. I have the chance to know people that I wish I met them before because they're a great team. We didn't select each other, but the situation put us together. So it's one of the maybe 2 years, the best years in my life ever. So look as opportunity, as a chance to know new people, new experience, new information. Leaders can grow and teams align. It's not the most intellectual of the species that survive, not the strongest, but those able to adapt and adjust best to changing environment in which it finds itself. Uncertainty is formed by turbulent changes and represent an opportunity for leaders and teams to make a difference in the world, not only in KMCJ. Okay, you want to hear the Mama Ruwaida message?
Yes.
What do you think? This is my Mama Ruwaida message.
Dear all, good afternoon. I hope you enjoyed the presentation.
Sometimes we are thinking it's major things, but it's not. So try to enjoy even the most difficult situations in your life, because this is life. Right. Do we have enough time to play a game in 15 seconds? Right. I will ask you please to search Kahoot in your Google. One of the most important strategy in my life for education is to learn others by fun. We will go to Kahoot. Kahoot, Kahoot. You will select the first one. The website. You نفس الويب It will ask you to give. And I will do look in, but into لا.
ايه هجين على طول الفيلم.
يا هلا بتدوري على بيت حراج عقار
ايوه لحظه.
عقار عمالة للبيع.
طيب هندخل هذا البن او we can do barcode for this picture. مين لسه ما دخل؟ Who's still not in. منال لو سمحتي سجل. كم العدد أستاذة جواهر؟ total number. نبدأ؟ Leading through uncertainty. True or false? Leading through uncertainty is significant. خلاص انت بس اختار هنا question. You will have the answer on your mobile. True or false? Leading through uncertainty is a significant aspect of leader job. الquestion حيكون هنا والانسر بالكلر كود حيكون على your mobile. تمام؟ سناء 10 seconds. Uncertainty is defined. ما حكوا عليك الصورة هنا. الانسر حيكون على your mobile. Uncertainty is defined as which color? الأحمر state of doubt. Uncertainty. The three types of uncertainty. Who is the winner? Sanal for the second time.
Sanal, شوية Sanal. Slow down, my son.
Slow down, Sanal.
The most important strategy for leading through uncertainty. Don't get alone. Don't be anxious. Embrace the discomfort. Welcome the change. كله the most important. The most important. Last question. Perfectionism is very important strategy during uncertainty. Perfectionism. خلاص 5 questions. نسرين هي المركز الثاني. Your name? Sanat, you're working? Emergency department? MashaAllah, that's why. Give him a big hug. Thank you. لا لازم يوقع عشان كلها بنشوفه.
وجدان area manager.
We're almost done. At the end of my presentations, I hope I did something you can use it in your daily life. If you have any questions, any concerns, I will be happy to answer it. Thank you.
Okay, thank you so much, Dr. Hannah Al-Jihani, for sharing your experience and expertise on how to lead during uncertainty and vulnerability. At this time, we want to appreciate our guest speaker. May I call on here our very active, hardworking nursing director, Ma'am Ruwaida Naholi, with our very supportive nursing manager, Ma'am Nisreen Al-Jihani, to award our certificate. Al-Jihani, sorry, ma'am. Okay, the certificate is awarded to Dr. Hawazen Rawas as an expression of appreciation for the valuable contribution as speaker in the Effective Nursing Leadership and Management course, which was held at King Abdullah Medical Complex, Jeddah, during the period of January 9 to 11, for a total of 6 training hours from CAMCJ Academic Affairs. Signed by Ms. Nisreen Al-Dijani, Nursing Education Manager, and Dr. Hanan Saban, Director of Academic Affairs, King Abdullah Medical Complex. Thank you, Dr. Hawazen. And at this time, may I call on Dr. Hannah Al-Jihani. Thank you, Doctor. Okay, thank you to all our speakers and thank you to our organizers. Thank you to all our audience. So tomorrow we'll be having the second day for our Effective Nursing Leadership and Management course. So thank you, everyone.